Hello, this is Dr. Jason Acevedo here to talk to you today a little bit about balloon sinuplasty. Uh, Balloon sinuplasty is a very common, very safe procedure, often performed in conjunction with turbinate reduction that's used to help patients that suffer from chronic sinusitis, which is essentially a chronic ongoing infection of your sinuses that can cause facial pressure, facial pain, congestion, postnasal drainage, headache, and decreased smell. Balloon sinuplasty is typically performed in the office. It can be performed local in some patients. More commonly, it's done with a mild sedation. So as far as what to expect if you or your loved one is scheduled for a balloon sinuplasty, as I mentioned, it'll be done in the office. You will want to avoid eating or drinking anything that day, just being on an empty stomach in case there's any nausea during the procedure. But you'll show up at the directed time. If you are having local anesthesia, what I do is spray some numbing medicines in the nose, put some little cotton in your nose that has numbing medicine, and then a few shots in the nose after things are good and numb. From that point, a small balloon dilator is used with the direction of a video endoscope inside your nose to find the blockages in your sinus passageways and using that little balloon device to dilate them. Now, as I mentioned, this is often done in conjunction with what's called a turbinate reduction, where these little shells of tissue inside your nose, called your turbinates, are shrunk down in size using a small tool called a microdebrider. And that microdebrider just removes the middle layer of the turbinate that causes so much of the congestion and postnasal drainage that's common among patients with chronic sinusitis. Now, as I mentioned, it's more common that patients would have this done with a mild sedation, and if that's the case, you would get an IV. An anesthetist would administer some sedating medications so that you don't feel anything, you don't remember anything, but it's not a general anesthetic. There's not a breathing tube. There's not a lot of nausea or discomfort afterwards. It's pretty much basically a short nap that lets me go in and open those sinuses and get everything working properly. And whichever way it's done typically is about a 30-minute procedure. And after you're finished with the procedure, you would stay in the office until you're more awake and feeling back to normal. You will need a driver, someone to bring you and take you home, just because some of those sedating medications can leave you feeling a little loopy. And the recovery is very, very minimal, very mild. There's typically not any packing inside the nose, no splints. So after the procedure, you can breathe through your nose. Now, I do tell patients to try to avoid blowing your nose that first week, just because after the procedure, there can be some minor on again, off again bleeding, and blowing the nose can make that worse. So you definitely want to keep that to a minimum. I do ask patients not to exert themselves for the first week. So if you like to lift weights or work out at the gym, or if your job entails a lot of heavy lifting, you do want to minimize that. Other than that, it is, like I said, a pretty quick recovery. We typically don't even need any narcotic pain medicine afterwards. Usually Motrin and Tylenol is all you would need. You can eat and drink normally after the procedure. You're up on your feet the next day. I've had plenty of patients play golf or work in the yard within 48 hours, and that's perfectly fine as long as you're easing into it. And as I mentioned with bleeding, it is not uncommon to have a little bleeding after the procedure. I tell patients a simple trick you can do is get some over-the-counter Afrin or oxymetazoline nasal spray from your pharmacy. A little bit of spray in the nose if you're seeing a little bit of bleeding can help dry that up. Or if it seems like it's really oozing more than you'd expect, you can even take a cotton ball and soak it in that Afrin and make a little plug inside the nose. I also like on the first day after your procedure to start using a sinus irrigation, which will be sent home with you. That just helps to flush out the sinuses and clean them. And you may notice some blood, you may notice some really unpleasant looking stuff coming out of your nose and sinuses, but that's good. That's what we're aiming for, is to start getting that infection out. And I'd recommend doing that rinse at least once a day. starting on the first day after surgery. It's okay to do it more than that if you'd like to, because it does help to clean those sinuses out. And a lot of patients will tell you they feel much better after they've irrigated. And then you'll also be sent home with a postoperative sheet that reiterates everything I've just told you, has the number to the office in case you do have any questions or concerns. And you'll typically be scheduled for a follow-up at about 7 to 10 days to see how things are going. But that really should be about it. It is, like I mentioned, a very safe procedure. Complications are very few and far between. As I mentioned, bleeding is always a little possibility. Infection is very rare, so we don't prescribe antibiotics afterwards. Probably the biggest risk of any surgery of this nature is that if it weren't to fix the problem. So say if your sinus infections were persisting or your symptoms persist. Fortunately, that's very rare, and studies have shown that compared to the traditional sinus surgery, for the right candidates, this procedure is almost equally effective, and with a success rate of about 94 to 95% satisfied patients. So it's done a lot of good for a lot of patients, and hopefully it will for you or your loved one.